I have a doctor. Let me give him the opportunity to introduce himself to you. Good morning, sir.
Morning.
Yeah. So someone out there wants to know who you are.
Well, Dr. Brian Rushaju, I'm a dental surgeon and team leader of Run Dental Clinics and NGO.
Oh, wow, nice having you here.
Thank you.
We are going to talk about dental health, oral dental health. So someone out there wants to know what's oral dental health. What's that in particular? What is it? Is it just brushing your teeth? What's that?
Well, I think it's a number of things concerning not only teeth, but the supporting structures of teeth.
Not only that, teeth.
And also, the oral cavity, the mouth has a number of structures there. So your tongue, your gums, so that whole structure has to be looked after, has to be, and not only that, but also the facial, the facial region. You've got to make sure that everything is in order.
Everything is in order, so there is a link between
the teeth and the entire body. Actually, there's something we call oral manifestations of systemic problems, So sometimes when you have other challenges, diabetes, you have all these issues, they can be reflected in the mouth. And so the mouth is actually a mirror to the body. Yes.
It's just a mirror in the body. It's a reflection of other things, eh?
So when you look into your mouth, you can be able to tell so many things that are going on in somebody's mouth, in somebody's body.
Okay.
Yes.
So are there types of dental diseases, or it's just tooth decay? People think it's only tooth decay that's associated.
Well, mainly in the whole world, there are two main problems that people face. Mainly tooth decay and gum disease. So those are two common problems that you have. But there are other challenges, of course, that you have, or ulcers, you have, conditions that may be cancerous, tumors, and all sorts of things that affect the facial region. But mainly, you're having tooth decay and the gum disease that are affecting almost maybe 80% of the world's population.
Okay, so the gum disease is the gum being in pain. Is that the gum disease, or?
Well, so now the gums are supporting structures, and these gums are if you look at our model here. So the tooth is embedded in a bone, and in that bone, it has fibers and things which are holding it in place. But eventually it has the gum, and there are also fibers from the gum onto the teeth. So this whole system is really supporting the gums, the teeth.
The teeth, yeah.
So when you get issues, dental problems, like cariculus, you're not brushing very well, and then these cariculus dimples, or the food that has stuck on the teeth, they tend to also irritate the gums. So when they irritate the gums, then the gums will disappear, or they will recede. When they recede, definitely you're having the whole system that supports the teeth being affected.
Okay.
Yes.
So you've talked about not brushing very well. What's brushing very well?
Okay, so when we talk about brushing very well, we are looking at having a good toothbrush. And
is a good toothbrush the hard one, the soft one,
Well, it's really the preference. It depends on somebody's preference. But we don't encourage the one which is too hard. Again, the one which is too soft may not help you.
Yeah.
But everyone has what they like, and what works for you is a good toothbrush. So what really we are talking about is being able to brush all the teeth. And in brushing all the teeth, we encourage that you brush without putting toothpaste first. So you first remove food from the teeth.
We just brush. You can put water like.
Yes, you can put water. You wash your brush, and then you start brushing. And when you clean the upper teeth first, preferably, you put the toothbrush at an angle 45, and then you start stroking down.
That's before the toothpaste.
Before the toothpaste, you're just cleaning. You're removing food. So you brush going down, brush going down. Now
you also brush the gum.
of course, you start from the gum, you know, and then you brush it, your teeth,
Downwards.
you know. So you put at angle 45 towards the gum,
Okay.
and then you tilt, okay. Then you go to the lower teeth, you do the same.
Yeah.
Now we discourage this business of brushing horizontally.
business we
in
do.
in the whatever.
Yeah.
But on top of the teeth, you can brush
Okay. In a
these
circular way.
straws. Now, when you finish brushing like that, you've removed food.
Yeah.
The second time you wash your toothbrush, put toothpaste, and then you repeat the same procedure.
Okay.
So that really the toothpaste is able to reach the teeth, not the
Not the
food which is really
Oh,
blocking you.
okay.
Because the toothpaste, what you need from toothpaste, mainly fluoride ions, they're able to reach the teeth, you know, in a chemical reaction. So when you prevent it, when you have things that are coating the teeth that cannot allow the toothpaste to reach, it becomes a problem. You don't get effective brushing. But also we encourage that you don't rinse immediately.
Oh.
Because when you put water, you're going to dilute this process, this chemical reaction that is taking place for the ions to move from the toothpaste onto the what? Onto the teeth.
So you have to first take like how long to rinse?
So we encourage, actually we encourage that you speed and don't rinse if possible. But there are people who cannot manage that, so we encourage that you can just take maybe some 2-3 minutes and then you can be able to rinse. Yeah.
Then how about the tongue?
So brushing the tongue is very important. You know, we encourage that you pull out your tongue and then you're able to clean it, because sometimes the bacteria that is responsible for bad smell, bad breath,
Comes from the
they are on the posterior part of the tongue. So it's very important to clean your tongue as well.
So is there a way of cleaning the tongue or
No, just strokes going outside.
Going
Just-
outside.
Yeah, just you stroke going outside.
with a toothpaste? For
Of
the
course,
tongue.
every time you're brushing, whether without toothpaste or with toothpaste, you do the same thing.
Oh.
Yes.
Wow, that's really nice. What causes the tooth diseases?
Well, so that's a good question. So mainly, when we eat food and leave it in the mouth, mainly refined sugars, foods that are carbohydrates. In the mouth, we have oral bacteria. This bacteria is good bacteria. It's called normal flora. We have it all over the body. We have it everywhere actually. So normal flora is supposed to be there. It's supposed to be
in the
in our
teeth.
skin, in the intestines, everywhere we have normal flora. So this bacteria, mainly Streptococcus mutans in the mouth, they will start eating the food that you leave there. So when they eat that food and break it down, it's no longer food but something else.
Okay.
So the end products of eating that food is an acid, lactic acid. So that acid is what begins to remove calcium ions from the tooth. Okay? So in the process we call demineralization. So they start to demineralize the tooth.
Okay.
So we remove calcium ions. When the calcium ions, you can look at, for example, a building where you are removing bricks.
Yeah.
So what remains is really cement, which
Cement.
eventually collapses.
Yeah.
So you get a cavity, you get a hole. So you call it a cavity in our language, but tooth decay. So when you do not brush effectively in order to replace the lost calcium, so if the acid has removed the calcium, the toothpaste, you're supposed to be having a good toothpaste where you're picking fluoride ions, which replace that lost calcium.
So there are also bad toothpastes.
I mean, a lot of the toothpaste we have on our market here is useless.
Really?
Yeah,
Useless.
Yes, because a good toothpaste, should be having the main ingredient as calcium sodium fluoride.
So we should look out for that.
Yes,
when you're
as
buying
the main
toothpaste.
ingredient. Sometimes when you have sodium monofluorophosphate, the fluoride in there remains bound. It's not free. Doesn't actually help you. It is there, but the combination gets stuck with the bicarbonates, and then it doesn't really help
doesn't
you
help.
in the sense. And that's a lot of the toothpaste that we have.
So we have to brush after eating, so that the
Yes.
the particles don't remain there.
Remain in the mouth, especially at night, because when you we actually tease my patients, said even if you don't brush in the morning, but it's very important to brush at night, because at night you have all those hours uninterrupted.
Yeah.
The bacteria is just doing its business. By morning, the damage is too much. Yeah. So we encourage that at least You don't go to bed without brushing your teeth.
So you've talked about the toothpaste in the market. Really, they are not okay. How about the mouthwashes?
Okay, so mouthwashes, they have a number of chemicals that are put in those mouthwashes, and they're mainly to reduce on the bacteria, the antibacterial, most of them, and the majority really depending on what is good for you. They work. The only challenge that I see is that people tend to use it all the time without the dentist's recommendation, which is dangerous because if you keep using a mouthwash over a long period of time, you're going to eliminate this good bacteria. And then all microorganisms will thrive. So you keep having candida and you don't know where it's coming from. But you have eliminated a lot of the oral microbes, mainly the bacteria. When you eliminate it, then other things come up. So it is important to use the mouthwash on the recommendation of a dentist. If, for example, they have cleaned your teeth and the dentist sees that maybe your gum health was not good, you can recommend using a mouthwash for a period of time.
Some people tend to chew the toothpaste and use mouthwash, and they go on with their day.
To chew the mouthwash and use
they chew the toothpaste and I have a mouthwash, let me just use it. And
I think there are very few which have fluoride in them, and because of they're already dilute, you may not actually benefit from the fluoride. And why we're using toothpaste mainly, we want the fluoride iron. Okay, it's not soap like washing clothes, and no. Mainly you want fluoride iron, as well as they have abrasives which help to clean the teeth. But the main important thing is, it's useless to have a clean tooth but which is decay. So the most important thing is that you want that fluoride iron from the toothpaste to remineralize your tooth.
And are there signs and symptoms that you get and be like, maybe I'm going to have some issue with my teeth, and look out for that? Are there signs and symptoms?
Yes, of course. When our teeth are really meant to be able to eat a full range of foods and without any problem. But when you begin to, as you eat, then you're getting sensitivity. Sometimes it begins with sensitivity. So you feel there's something wrong with your teeth. It could be an earlier sign that there is a problem. Some of them, it's, every time they eat, of course, if you have cavities, when food goes there, then it's a problem. You feel some pain.
Some pricking pain.
And at that moment, it's just pain that lasts for a very short time. And then people tend to ignore, because here, if you're not actually really bad off, you don't want even to go and see a dentist.
Until you're
but yet those are actually the beginning signs that are telling you there is a problem, and the earlier you go to see a dentist, the better. So I would really want patients to be able to look out. You're taking your soda, your cold soda. When you take it, sensitivity comes up. I think that's a good time to go and check and say what could be wrong before you wait for this terrible pain that doesn't allow you to sleep. Because many people come at that stage.
That stage of
when I can't sleep.
So you should look out for that.
Immediately, that sensitivity, that small pain that comes while eating, that's really one would call irreversible pain. It's reversible. But when you wait for the one which comes constantly through the night and you can't sleep, sometimes that's really irreversible pain.
Okay, let's go in for a short break. We'll be back still talking about our dental health. Catch you later.
Do you have a business that you are looking to grow? Advertising with Church of Uganda Family TV is the way to go. We are located on Church House, level 13, along Kampala Road. We offer favorable rates and an extremely creative production team that will work with you to take your business to the next level. To give us a ring, call us on 0781 084215 or 0750 655232. Church of Uganda Family TV, enriching lives.
Whether it is Katogo, Chikomando, Rolex Majasa to Nyanya Mbisi. Man, wherever I am, I enjoy you with your TV channels on my phone.
Nyumiro omurembo omupya ogujjudde ebisanyusa omuli emikutu gya TV egisukka mu 8 n'egya radio nga kw'otadde ne zifirimu ng'osinziirira wonna w'oli. Genda mu App Store oteeke app ya TV channels ku simu yo olwo onyumirwe ennaku 3 ng'olabira bwereere ewatali kukozesa data.
Yo TV channels, the power is in your hands.
Easy Change Forex Bureau. We deal in all major foreign currencies like US dollars, British pounds, euros, Kenya shillings, and very many others. We are located at Church House Level 1, Shop Number 4 along Kampala Road. We operate from Monday to Friday 8:30 a.m. to 5 p.m. and on Saturday 9 a.m. to 3 p.m. For more information, contact us on 0706 09 4189 or 0783 837363. For the best forex rates, Easy Change Forex Bureau is your answer.
Thank you for watching Morning Glory Family TV. If you've just joined us, we have a dentist surgeon, and we're talking about dental health. So we were still talking about, you were telling us about the food stuff, like when you eat something and feel, it's sensitive. There are some people out there who really can't live without eating those cold things, the cold soda. They drink soda like every day. Are they at risk? The very hot things. There are some who really love the coffee every now and then. They're having a cup of coffee. Are they at risk?
Well, that's a good question. Thank you. I think our teeth are actually meant to handle a full range of foods.
Okay. I heard the hardest part.
Yes. The enamel, which covers the tooth, is one of the hardest parts in the body. But it's able to handle a full range of foods, whether cold or very hot, hot coffee, hot tea. If your teeth are sound and they don't have cracks, the people who open sodas that, you see them on the parties, they open as delayed and they're opening, and so your teeth can get cracks. And so
you might not tell.
And you may not tell because there may be small micro cracks. And when you have some of these cracks, then of course when you take anything extremely hot or cold, definitely it will be sensitive. But when your teeth are sound, they can handle really most cold temperatures. I mean, which are not very extreme, of course, but some cold soda should be able to handle that. Some hot coffee, your teeth should be able to handle that.
Okay.
The challenge is that, of course, when you talk about soda, you talk about these beverages, they have now another problem that they do to the teeth, because these refined sugars, which are sticky, they will stick on the teeth, and then, as I said, they tend to last longer. If the clearance rate of something which is not a refined sugar, could be within after meal, after I've eaten my matoke and cassava, homegrown food, it may clear off the teeth very fast. But these refined sugars tend to last longer. And when that component of time is a factor in tooth decay, so the longer these beverages stick on the teeth and stay on the teeth, that means there are more opportunity for the bacteria to eat these things and then produce the acids. And so that's what we don't like about the refined sugars, the sodas, these other beverages, the ice cream, you know, the sugar component and the ability to stick on the teeth. That's what we don't like. Yes.
So
but in terms of being cold or being hot,
it's
if
okay.
teeth are sound, you should be able to handle.
Okay, so we should have a limit to be like, no, let me stop taking the soda because you never know.
Well, the issue actually should be, we don't discourage people from taking these beverages because it's not possible. I mean, these are sugars, people like them. What we encourage is what you do after. You know, we encourage if you are not having your toothbrush in order to brush after, at least have a glass of water. Try to dilute, you know, this effect, okay? Have, you know, a bottle of water around and be able to drink water after. But if you have, and also we tend to encourage, limit these foods to meal time. Okay? Limit ice cream, the soda beverage to meal time so that you can be able to brush after. Snacking in between meals is one of the most dangerous things. You know, just have a cake now, then after 15 minutes soda, then after 10 minutes another. So that snacking can be dangerous. But if you limit it to meals, and then you're able to clean after, drink your water and then dilute it. If you don't have your toothbrush, then it can help you. That can help you.
Okay, so let's look at the preventive measures of the tooth diseases.
Yes.
Yeah, like, do you have like the certain foods that you should eat, like that, so that you help yourself from getting such diseases?
Yeah, of course. Now, like I said, this tooth decay is really driven by sugar, and so if one can avoid or actually limit, that's a good way of preventing. Okay.
Yeah.
So we encourage that you limit and mainly limit it towards meal time.
Meal time.
This snacking business, you're just watching TV and all the time on sugary things, that can be dangerous. Okay. And then we encourage that, of course, bring the children as early as the first year. As the first teeth come into the mouth, these children should be going to see a dentist. Then they begin to work with the dentist. The dentist has ability to tell the issues that are about to come into this.
Oh, you can tell.
Mouth. I mean, when we look at the way these teeth are presented to us, of course, when they come late, then we begin to monitor. We begin to know, are they at risk? We're looking at how they are presented. They are not brushing because most of these kids do not have the ability to brush. Then the parents also don't help them to brush. So sometimes you see, by the time they come, you're already seeing a mess. Okay, so when we begin to see these kids early, we begin to advise. We begin to notice some things that may happen. Okay, things like malalignment. You can be able to tell when they're in the primary dentition, and then sometimes you can intervene. Then you can do an interceptive treatment, or you can actually modify the way things are going, or at least you notify them so that by the right age they can come back.
You're talking about kids, the false teeth.
Yes,
maybe someone out there wants to know what causes, how they should go about that, the false teeth.
Well, that's a good question. I have through the NGO I've been privileged to travel in the whole country, and the areas and communities where this false teeth issue is, especially in cattle keepers, you find that when the kids are growing, when the teeth actually about to appear in the mouth, that process we actually call it eruption. Eruption comes with some force.
Okay.
So most of the time, as these teeth are about to appear into the mouth, that force, that pressure, can overtake the child and lead to, of course, one, the child will be touching there, and then it can lead to diarrhea, it can lead to
diarrhea,
even temperature, so it can overtake the strength of the child at that time. And so what people do, and of course it appears like a swelling, okay, the place where it's going to come, because it's about to burst out. So people think maybe this is a germ. They have all sorts of theories, and they usually take them to nearby. There are always the toothers in the community there who use a bicycle spoke, sometimes things which are not sterile. They pierce and then try to force this thing to come out. And because this tooth has not yet mineralized has not yet received calcium, has not yet become strong, it is usually worm blades. It's really milky. So they think it's a worm. They will think it's no, yet it is a tooth. It is not yet just been remineralized. So eventually they pierce the mouth, and you tend to see the gaps, the places where they do that. Teeth never develop, or if they actually come, they come when they are deformed. So it's a really bad problem, which is really here in poor countries. You don't seem to see it in a developed country, because you're supposed to manage that temperature. You're supposed to take the
know
kid.
that this is probably the stage.
Yes. The kid is taken to hospital and managed. All these symptoms should be managed. Of course, if you don't manage, the temperature can overtake a child and kill the child. The diarrhea, can kill a child.
Can.
Yes, the diarrhea can kill a child. And so if these things, the symptoms are not managed, they can kill a child, but not the teeth that are developing. So people tend to associate it with the teeth that are coming out, instead of looking at the changes that are happening and managing them accordingly. And so we really discouraged the issue of removing false teeth, because they're really not false. And some people have asked me, but these teeth tend to come early, early. A child is born, and a few months later, these teeth are appearing in the mouth, so we think they are false. But I encourage them that these teeth have developed even before the child was born. When you're still in your mother's womb, teeth are being formed. Okay, so if a child is really hyperactive, there are those who are growing very fast. Teeth can pop up in the mouth earlier than we expect. And so that does not really mean that there is a problem with this child, and so these are false teeth, we should remove them. No, I think one should be able to take this kid to the nearby health facility, manage the symptoms, but leave the teeth.
Leave the teeth to grow. That's their stage.
That's right.
Their stage.
That's right.
So some I get questions.
Yes.
Yeah, like why do I wear braces? Some people think it's swag. So please let them know that it's not swag.
Yes.
But please let them know the reason why I might be wearing braces, or someone out there.
Yes. So when we have when we're growing up, sometimes these teeth are supposed to be in a certain relationship to each other.
Okay.
So each tooth has a corresponding tooth. The lower tooth has a corresponding tooth up that it works with. Okay. And it is supposed to be in a certain, meeting each other at a certain angle, a certain, degree. And when the high point of the upper tooth, for example, if the camera can capture this, so you find that the high point of this tooth is supposed to be maybe going into the depression of the lower tooth. Okay, so that occlusion, what we call occlusion, the maximum intercuspation of teeth, is helpful for us to eat, to do all sorts of things. But sometimes teeth get out of order, and mainly the milk teeth, because many people don't care about these milk teeth. But these milk teeth are important. They're there to guide the permanent teeth into place. So mainly when you find the baby molar, the baby molar, which we call here fives, or the E's in the developed world. These baby molars, they help to keep the permanent molar, which comes later at the age of 6, to keep it in place. But when it decays and comes out early, the permanent tooth will drift forward. When it drifts forward, it means that the space they were supposed to keep, the baby molars, the teeth they were supposed to, the space they were supposed to keep, which is called the leeway space, will be lost. When it is lost, because this molar now has moved forward, it means when the teeth which come later in life, the canines, when they come later, they will not find enough space. So they will be crowded. Okay? So when they are crowded, definitely they don't appear nice. The one is on top of each other. And many times people go and say, oh, this one which is out of the way, pull it out. Okay? But that is not the best option. So what we do, we can give you braces after making an assessment and seeing where did this problem come from. We can put braces and they will arrange again the teeth in place. They will move the teeth to where we want them to be, so that you can achieve again the occlusion that will work for you.
That will work for you.
Yes. So that's not decoration.
It's not
There's
decoration.
something going on in order to make your teeth appear nice.
There's some development going on. You know,
Yes.
some people have crooked teeth. Like
Yes.
they can't smile. They feel that they can't smile. They're shocking.
That's right.
So if you can go and he checks you out and he tells you
That's
what
right.
to do. So
That's
another question: if I have tooth decay,
Yes.
is the only solution for it removing the tooth?
That's a good question. In the past, before dentistry really, dentistry has been developing in Uganda. We were celebrating 60 years of,
Wow,
of
that's a
dentistry. Yeah, that we actually still in the celebration. But before, you would find that the only option if something pain, and also in the villages where the facilities are not as common as here in Kampala, you feel pain, they go and remove. But what we really encourage is that when you go early, we can feel that tooth, that cavity, okay? We
And
can
so-
put a feeling and then that tooth will be saved. The problem is that if the decay has actually reached the inner parts of the tooth, like the pulp, then we may do what we call a root canal. We can remove that pulp, that inside part, we can remove it and then replace it with an artificial pulp or something artificial, okay? So that's called a root canal. You do a root canal, you desensitize the tooth, but the tooth remains
There.
in the mouth, okay? Now, sometimes it's too bad, you know, the infection.
Yeah.
Infection has gone,
Yeah,
even
has
maybe in the
spread.
neighboring regions. It is in the spaces around.
Yeah.
And finally, we have to take out the tooth. But we wouldn't really love to take the tooth out unless, you know, it is that bad. It is fractured and broken and, you know, is really nothing remaining. The roots remaining, then sometimes you're forced to take them out. But I would have loved that we feel it.
Yeah.
And you know, it's cheaper when you do prevention.
Yeah.
You come and
Prevention is always
check,
cheaper.
and then sometimes before even the decay appears, we're able to do some fluoride, you know, maybe varnish. We're able to help you, you know, how to clean, you know, or we can do sealants if they're minor decay that is starting, you know. So there's things that can be done that are cheaper, but the problem is that you always wait. And by the time you come, the pulp is involved. Then the dentist tell you root canal. Root canal may be expensive. So somebody say, remove the tooth, okay? So we wouldn't want really to say the solution
Sometimes
of tooth decay is removal. There are several things that can be done. The only challenge is people coming late and not having maybe the money to fix the problem at that level. Yes.
Okay, let's go in for a short break. We'll be back with your questions on our social media platforms. Catch you later.
Uganda Matters Seminary Namugongo invites applications for full-time, part-time and distance learning diploma and certificate academic programs in child development and children ministry, guidance and counseling, community development, Christian ministries, business administration and management, information technology, project planning and management, public administration, social work and social administration. Entry Certificate of Education and Uganda Advanced Certificate of Education with at least one principal pass and 2 subsidiary passes or the equivalent. For certificates, one should have Uganda Certificate of Education with a credit in English language or the equivalent. Uganda Matters Seminary Namugongo is fully accredited by the National Council for Higher Education and is affiliated to Uganda Christian University. The fees are affordable. For details, call 0392 174 957 or 0758 166 301.
Do you have a business that you are looking to grow? Advertising with Church of Uganda Family TV is the way to go. We are located on Church House, level 13, along Kampala Road. We offer favorable rates and an extremely creative production team that will work with you to take your business to the next level. To give us a ring, call us on 0781 084215 or 0750 655232. Church of Uganda Family TV, enriching lives.
Kinayu kinyumira. Whether it is Katogo, Chikomando, Rolex Majasa to Nyanya Mbisi. Man, wherever I am, I enjoy Chinayu with your TV channels on my phone.
Nyumira omulembe omupya ogujjudde ebisanyusa omuli emikutu gya TV egisukka mu 8 n'egya radio nga kw'otadde ne zifirimu ng'osinziirira wonna w'oli. Genda mu App Store oteeke app ya yo TV channels ku simu yo olwo onyumirwa ennaku 3 ng'olabira bwereere ewatali kozesa data.
Yo TV channels, the power is in your hands.
Welcome back from that short break. I'm going to read the questions that are on our social media platform. Get us live. We are live on Facebook. That is COU Family TV, Instagram Family TV. Yeah. So we have a question to you. Tell me about using charcoal vinegar to brush. Isn't it risky?
Okay, that's interesting. Thank you. Well, I know that so many people use charcoal in order to clean their teeth.
Yeah.
We have a problem with that.
Okay.
Of course, in the past and in the village,
Yeah.
you can use a chewing stick. Okay, you can just make your chewing stick, smooth in order to be able to use it to brush your teeth. That is okay, especially when you're not really eating a lot of refined sugars. Toothbrush, a chewing stick can be enough.
Yeah.
But you've got to be patient to brush each tooth one after another. Okay. Now, when you get to charcoal, sometimes, of course, and the ash and many people use so many things. We may not like where you're picking it from. You may really not pick something nice. So when you use charcoal, one, it may be that and introduce things into the mouth, okay? But two, it may be more abrasive and instead remove a layer that actually you need. Okay, so we don't want to use some of those things because of the abrasive nature and the way they may do more harm than good. They may actually help, but because they're coming from a chewing stick, I'm comfortable giving an advice for somebody to pick a fresh stick from a tree and then be able to use it to clean. Okay. So vinegar and all these other chemicals can erode, can remove the necessary elements or minerals that we need, and you end up with hypersensitivity. Okay. Yes.
Some people say charcoal helps with removing the yellowish stuff on the teeth.
The stains.
The stains, yeah.
Yes. It may help, but what we are saying is it may be too much, okay? And then you find that it is actually doing damage. Okay. So that's what we may not like. And a tooth is supposed to be shiny, supposed to be, because when you get scratches, then its ability to retain more stuff. So the stains later, they're going to be many.
Yeah.
So we encourage that we use something which is not, again, very tough on the teeth, in order not to create more damage to the teeth.
Okay. Why is it that some people brush yet they still smell?
Yeah, well, the issue of bad breath
Yeah.
is bigger than. So well, you can have teeth which are decaying. Okay, that decay process in the teeth can cause bad smell.
Okay.
You can have gum disease. There are conditions, okay, like ulcerative necrotizing, diseases. They will smell because the gums are sick. Okay, so even when you just remove the food, the condition remains.
Inside.
The teeth are decaying, but also the gums have issues. And not until you treat some of those conditions, the bad breath may not go away. And then there are others, of course, if you're not brushing your tongue very well, like we said, some bad bacteria stays at the posterior part of the tongue. And so many people don't bother to brush the tongue. So you keep smelling.
Okay.
But to others, it can be a systemic problem, like I started sharing. You could have most of the time problems in the stomach. Okay, you are regurgitating, you're bringing back feedback from the stomach. Okay, and some of them, those reflux diseases, you find that every time you're belching, you're bringing back something from the stomach which is not supposed to be in the mouth, and that can also be cause bad breath. Okay, yeah. So, but also people need to know that certain foods tend to stay in our system for some time. If you're eating garlic, definitely you don't expect to have until that garlic gets out of your body, you may have bad breath.
So should we look out at eating garlic all the time?
Well, people take it for different reasons. So if you don't mind, if you want to have a benefit of garlic, then maybe you'll bear with the bad breath. Or you have, because it will be there until it gets out of the system. Or you will have some mouth sprays. We have some scented mouth chewing gums that can help to refresh your breath.
Alright. So we have Dijozi na chewing. Thanks for the show, watching from Dubai. Thank you, Dijozi, watching from Dubai. The other question is, what issues do the elderly face in terms of oral health care?
Oh, that's a good question. Yeah, the elderly, of course, most of them will lose the dexterity of being able to clean very well, and so they tend to have issues. But also with age, sometimes if they didn't look after their gums very well, you tend to see the gums receding, and then the teeth are shaking. Most of the elderly people, some of them the majority, the teeth would have fallen out, but the others, the teeth are shaking, and that largely because over time they did not look after their gums very well. Others, it's an issue of, you see some of them who didn't actually look at the occlusion seriously, like you're doing braces. You're preventing not only the way the teeth look like, but the way the teeth relate to each other. Sometimes when you don't handle that, you find that the teeth tend to eat up, as if you're slicing your teeth. So they keep eating up each other. Okay, so most of the elderly people, they come up with some of these problems that have been chronic over time, and really sometimes hard to fix or too late to fix, and most of the time they may lose these teeth. And so the elderly people have to be supported. I strongly believe they've got to keep on also having to see the dentist, because something can be done. If they have lost most of the teeth, we can give them replacements. We can give them artificial teeth to really. So because they still need to eat, they still need to have good health, and if we're having these issues and you ignore them, it's going to be a problem. Yeah. So it's important that whatever stage, whatever problem there is, we can still see them. We can still be able to do something.
Okay. In conclusion, is there any last word, any last advice to someone out there about dental health?
Well, my message really is that one should be able to clean their teeth at least 2 times a day.
At least
2 times a day, in the morning and evening. Some people do an extra lunchtime brushing, but it's not easy. But if you do that and then secondly, you visit a dentist.
Okay.
We recommend you to see a dentist 6 months.
Oh.
Sometimes
That's
when
twice a year.
Yes, twice a year. If you are not at risk, we may give you, if you've been seeing a dentist, the dentist may say, okay, maybe you can come once a year. But if you're at risk, the dentist needs to keep checking and cleaning your teeth. Okay, that's like doing a service for the way we do service for the car. It's important to be able to clean your teeth. And when you visit the dentist every 6 months, then he can be able to also see other problems that are coming up and fix them. So seeing a dentist is very important. Eating well and avoiding these sugary foods is also equally important.
Okay. So he was Dr. Rushaju R. Brian, run dental clinic, Akamwesi Shopping Mall, 2nd floor, Chirando, Gayaza Road. You can get him on info at runddental.org or www.runddental.org. His Facebook is Run Dental Organization. Yeah, and his Instagram is Run Dental Organization. That was our guest today. Thank you for watching Morning Glory Family TV. Catch you tomorrow, same time, same place. Love you. Bye.
Do you have a business that you are looking to grow? Advertising with Church of Uganda Family TV is the way to go.